Breakout Session B, Vision Loss and Mental Health, Dealing with Anxiety and Depression with Dr. Cathy Braidek. And I'm Erin George. I'm the Communications Manager here at the Foundation Fighting Blindness. And Dr. Braidek is a geriatric psychiatrist who has worked at the University of Ottawa and Royal Ottawa Hospital in the geriatric psychiatry program since 1990. She is Director of Outpatient Services. And Dr. Braidek is also legally blind due to Stargardt's macular dystrophy. So she's uniquely positioned both professionally and personally to speak to this subject matter. So we're really lucky to have her here today. And without any further ado, please welcome Dr. Braidek.
Good afternoon, everyone. Can you hear me with this microphone? Okay, wonderful. Good. First, I'm looking through the audience, and I have very limited vision myself, so I'm looking and thinking there's probably about 30 to 40 people here. Would that be about right? Anybody sighted can tell me? Yes? Okay. And how many of you have vision loss? Can you put up your hand? Okay. Or clap, yeah. About a dozen. Okay, wonderful. So this talk is for you and for the caregivers that come with you today. I'm speaking to you as a geriatric psychiatrist my average age of my patients is 85, many of whom suffer multiple sensory losses, including vision loss. I'm also speaking to you as an assistant professor of psychiatry. I teach medical students, residents, fellows, other health professionals. But I'm also speaking to you as a person who suffers from a progressive macular dystrophy. So I have experienced myself. I was diagnosed when I was 18 as having Stargardt's disease, and I've been legally blind for about 12 years. So I speak from all those different points of view to tell you about what it is to suffer vision loss and the mental health consequences of that. I'm not going to be talking to you about scary stuff today or trying to convince you all to be admitted to hospital or take pills. I am going to talk to you about the most common experience, mental health-wise, with a progressive loss, and that is grief. And grief is a multifaceted experience to a significant loss. Grief we usually associate with the loss of a loved one, perhaps a person or a pet. The loss of your vision is something so different because it happens gradually. So you're always adjusting to the loss as it goes along. You're diagnosed as having retinal disease. Then you have to learn that you're not a healthy person anymore. As time goes on, you realize that there's things that you can no longer do that you used to enjoy. There's people that you can no longer visit with that you used to enjoy. And things get stripped away from you bit by bit. So it's a progressive loss, and your grief has to adjust at every stage. Grief is also a multifaceted response. And probably one of the pioneers in grief work was Elizabeth Kubler-Ross, who is an American-Swiss psychiatrist whose body of work mostly encompasses death and dying and the grief associated with that. And she wrote a book in 1969 called On Death and Dying, and her grief work that she published was really done mostly in the 60s and 70s. There are more updated versions of grief work than that in the literature, but I think this one probably makes the most sense to me and to most people that I work with. So you're presented with a loss, and you go through different mental states in trying to cope with that loss. That doesn't mean that they happen one after another and that they're completely finished. It's more like you're in a state of flux between these stages. And there's times when you are denying that you have an illness. Lots of people do this. I was speaking to a gentleman just before the talk. you have an illness, and then you get a retinal detachment, and you just say, no, it can't be happening, I'm not going to get it fixed. Sometimes you think maybe the diagnosis is wrong because the sunlight is brighter, you have a better day, you're more well-rested. It's easy to push that kind of thought that maybe this isn't real out of your mind, especially at first and in early stages of vision loss. What a lot of people experience, and I'm sure many of you can identify with this, I certainly can, is anger. You feel so angry. Why did this happen to me? What did I do to deserve this? Why, you feel sorry for yourself, you feel bitter and angry, you lash out at people you love, they try to help you and you don't want help. That's a really tough stage, and that's one area that I really want to talk about, how not to get stuck in a rut in that anger mental state. You probably can also identify with another state where you're bargaining. This may take many forms. It may be that you pray or go to prayer meetings, healing meetings to try to get rid of your vision loss. It may be that you try to do everything possible in a healthy way to eat healthily and try to prevent this from happening. It may be that you say, well, if only I can finish my university, or if only I can have my children. And you sort of make these bargains with God or the disease or your doctors or your family. Sometimes people feel a real sense of sadness, and that's normal. Feeling sad that you're losing your vision and what goes along with that is a normal feeling. That kind of sadness may take the form of crying. It may take the form of feeling sorry for ourselves. You really have to know that is normal, to experience that, and that will happen intermittently through the illness. It may happen at different stages of vision loss. It may happen when you're first diagnosed, when you lose your ability to drive, when you lose your ability to work. So that's a normal experience. That's a key feeling in normal grief. When it becomes worrisome is if the sadness, the crying spells become pervasive. They last for weeks at a time. It starts to affect your sleep, your appetite, your ability to enjoy anything, your ability to concentrate and focus. And if you start feeling that you're not even worth it to live anymore or think of suicide, those are not normal signs of grief. That is something that you need to talk to your doctor about if that's happening. The other thing, when people get into that kind of a state, is they can be at high risk for risk-taking behaviors. They can be at high risk for substance use, and that includes alcohol, drugs, gambling. So those can be secondary problems that can grow when grief goes too far into a mood disorder. And that, again, is something to talk to a doctor about. Anxiety is a very normal part of losing vision in our world, which is so visual. Look around in this room. It's full of screens and decorations, chairs. Everything's very visual. You can walk, every time you walk into an environment that's unfamiliar to you, you don't know, is that a staircase in front of me? Is that a ramp or a step? Or is that just a change in the color of the floor? You have to realize that everything can provoke anxiety in those settings because we're worried about our personal safety. Having a companion with you, using a white cane, having adaptive devices, those will help, but that won't take away the angst that we all feel when we go into an unknown setting and try to negotiate it. And most of us especially early on in our vision loss, and some of us who are more stubborn like myself, even further on in, won't ask, is this the ladies' room or the men's room? So, you have those little exciting experiences where you walk into the wrong place and somebody, not so politely points out that you're in the wrong room, or that you're on the wrong bus. How many times I've gotten on a bus and said, is this the 96? And they say, didn't you look at the front of the bus? And then you show them your CNIB card with revenge in your eyes and secretly wish that they go blind in a very painful way. But, those experiences, you have to keep your sense of humor. You have to accept that people are there to help you, and mostly people are willing to help you. There's also an element of fear in that. I can remember when I first went blind and I was given my little set in Ottawa we get from OC Transpo, the public transit system, a set of cards that are white and black bold where you can set the number of bus you want in this little plastic folder. Then you're supposed to stand with that bus number out where the bus driver can see you as they're zooming past. Because there's actually places in Ottawa where a blind person is meant to flag down their own bus, which makes no sense to me, but that's what we're supposed to do. So at the end of my work day, I go to a place called Tunney's Pasture, which is it's a transitway station. It's dark. 5:30 to 6 o'clock in November, December, January, it's very dark. And I'm supposed to stand there with my hood on, my scarf on, my white cane, and a little sign that says 68 on it, and hope to God that a bus will see this and stop. And all I can think is, I'm a woman, I'm not that big, I've got a white cane that lets them know I can't see them, and here I am. That's what I think. And I know that all of you in your own ways must feel vulnerable at times too. I think that's part of the loss of a sense of security, the loss of independence, the loss of a feeling that if I was sighted and somebody came up behind me, I would see them, or, I would have a better chance of defending myself. So all of those things are components of our selfhood, the way we view ourselves, the way we view the people around us, the way that we view our world as a safe place for us. So you can see the number of losses that are starting to accumulate here in this list that I'm forming. Not just your sight, your activities, your sense of security. You do feel very vulnerable. I think, though, that there are ways to counteract this, and that's the positive part of this talk. Grief, anxiety, sadness, all those things are normal. They will come and go. You'll have bad days, bad weeks, but there's also very positive things. I think part of this conference, fighting blindness with research, is one of the positive things. Also, the adaptive devices that are available to us in 2013 are amazing. I often think if I had been born 100 years ago, I would have been on the farm in Saskatchewan with my family. What on earth would I have done? I wouldn't have been able to marry. I wouldn't have been able to have children, particularly, to raise them. I would have been, not a very productive person. And nowadays, we have access to different things. People understand blindness more. I think that people that were blind, I certainly know that I had some great aunts that had blindness back in the late 1800s, and that they never married and they never did anything really in their lives. They were sad people. But nowadays we have the ability to work. We have the ability to participate in recreation. As the Canadian population gets older, there will be more and more people suffering blindness, particularly from age-related macular degeneration, and I'm hoping that that will bring more services as well. Things that I am able to use at work, like a computer program that talks to me, a phone that talks to me, a phone that I can talk into and it will dial phone numbers. Those are helpful things. That doesn't take away the sadness and the grief, but it makes life better. I think of Stargardt's disease or my blinding disease as the enemy. It's the enemy. When I feel angry, that's what I feel angry about, is the disease, not me as a blind person. So I try to think of ways to fight back. And I think that it's important to do that because as a visually impaired or blind person, you may notice that your world gets smaller and smaller and smaller. And what you want to do is push the envelope, push back, keep in contact with people. Maybe you can't write letters anymore. Make phone calls. Dictate emails. Get somebody to help you with those things. Keep up friendships. If you can't go to movies and ballets and theater anymore, do something else. Go out for dinner. Have them over for tea. Watch a described video. Push back. It's so important to make sure that you keep up fun things in your life as well, recreational things. And, there's a lot of things you can't do when you're blind that you might have been able to do beforehand that gave you great pleasure. But it's important to find things that you can do that give you pleasure. So if you used to be a cyclist, get a tandem bike. If you used to be a walker, get a treadmill. These are safe ways of enjoying the kinds of things. If you used to love movies and TV, find a way to access described video. If you're suffering from loneliness and anxiety when you're alone, find places to go. Get out, go to the library, go to a public place where you can be with people. I think what's really important is to recognize that all of us who have vision loss and blindness will suffer these things from time to time. And it's not easy. It's not easy. But it's also important to think of the positive things. I think one thing that I always think is, yes, I have this progressive disease, but it's not painful for me. It's not terminal. I'm not going to die from it. And unlike some of you, and I don't mean to make light of this at all, but I always thank God that my children aren't affected. I think that if you can count the positive things in your life, when you're having a day, when you're having a pity party, which I have from time to time, what I do is I start thinking about the number of friends and colleagues and people that support me, that will reach out to me when I'm having a difficult time and say, can I give you a hand with something? I can see that you're not seeing well today. Can I give you a hand with something? And being able to say, yes, thank you. And there are good people around that will help you. I mean, just from the vast numbers of people that are here with you today and that I see walking around in the lobby, you all have somebody with you that cares about you and made sure you came to this conference. Reach out to those people, thank them, and talk to them too. I think that one of the hardest things of all is talking to people about the sadness and grief we feel with this progressive loss. And I think there should not be shame with that either. The fact that you do feel sad, anxious, fearful, depressed sometimes, that's okay. And if you're not, people don't want to hear that every single day, that you're having a bad day because you're noticing that your blindness is progressing, et cetera, et cetera. So you don't want to be spending all that time doing that, but it is good to have somebody you know that on a bad day you can phone up and just say, I'm having a terrible day, and have them listen. It helps take that burden off you. And if you don't have friends that can do that or family that can do that, there are counselors, psychologists, doctors, people that will help you to cope with that. The CNIB is also a good but limited resource for people to go to get adaptive devices, but also they have an IT department there, information technology department, that will help you with your Victor readers, your Daisy readers, your iPhones, your computers that you need. I think that, sometimes when you're listening to the news and you hear the situation in Syria or in the many countries in Africa that are suffering from problems, and you think, well, who am I to complain about my lot in life with my eyes? It's important to recognize that you were born as a whole person, and that was your expectation when you grew up. And to suddenly find out that your life has changed course through reasons that you can't control is a huge thing. And there will always be people better off and worse off than ourselves. It's important to recognize that your grief is legitimate, your loss is real. And if you can fight back and take back what you can, keep your world open, try to expand the people and activities in your life, that will go a long ways. If you start finding yourself dwelling on the negative, the sad, the anger, the bitterness, and your world is getting smaller and smaller, that's when it's time to reach out for help.